Dr. Campbell. He is a disc specialist, and what he does is something extraordinary where he can actually help you without surgery, which I think is absolutely amazing. Let me introduce him to you. So glad to have you come and visit us today. And, you know, support us with Wellness in the Woods, because I know you've been coming to our Wellness in the Woods events.
Yes.
And I thought it would be a good opportunity to let people know that there's alternatives.
Yes.
They don't have to just do surgery. And, you know, I don't even understand why people would get a herniated disc, and what is a herniated disc?
Well, thank you, Leslie. And first of all, welcome back from your trip. It's good to see you back home safe and sound. And, you know, something that is interesting to me is that statistically, 80 to 90% of the population is going to have some sort of back pain during the course of their life. And
You're kidding.
It's very, very common. And for the most part, these types of problems can be very minor, and we may do simple things at home like rest or ice or heat, or things like shoe inserts or change our mattress or pillow. And that can resolve that for the most part. That actually is not the type of patient that I specialize in. The type of patient that I specialize in is someone who actually has tried all of those and has failed.
Okay.
People who, for the most part, when people come to me, they already have a diagnosis of a degenerative disc condition, and that includes disc herniation, bulge or protrusion, stenosis, associated with back pain, sciatic pain, pain down the leg, numbness or tingling. And these are people who, while they've tried all of the standard of care treatments for this condition, they have failed. And they're sort of at the end of their rope. And when they come in to see me, oftentimes their spouse drives them, or they come in with a cane or a walker. And it's also not unusual for people to, as we consult with them, to even shed a tear, because when a person has a true serious disc problem, as we see, the older we get, we see more of this.
Of course.
It affects people, it affects their emotions, and the longer they have these conditions, the more disabilities it tends to develop.
Yes, definitely. I mean, when you can't walk properly, it's very stressful on mentally as well, just getting in and out of the car, doing just everyday normal things.
Everyday normal activities.
Yes. But why some people, they claim they have a backache or, you know, a herniated disc. They've been told they have a herniated disc. Why do they get worse?
Well, you know,
I mean, you know, some people just seem to have it forever.
That's true. And the basic reason is, the reason a disc can get worse and does get worse is because there isn't a well-known treatment that actually heals the disc. And I actually brought along something to kind of show that. I'm going to see how that comes out here on the TV. Okay, so this is a schematic of what a disc looks like. Over here we have a healthy spine.
Right.
Yeah, hold that right there, that's good. We have the vertebra, and we have the discs, or the whiter part. The white part over here is the spinal cord.
Okay.
But over here we can actually see where there's a disc bulging. This is actually an MRI, and when people have already had an MRI, they're able to get that diagnosis of what their condition is, where the disc has gone bad.
Oh, yes.
Okay, so that's what I want to talk about at this point.
So that means that where you see the little spot here over the spinal cord, it's bulging into the spinal cord, causing pressure?
That's what happens, is when the disc goes bad, is the disc is a very unique structure. It does not have its own internal blood supply or nerve supply, so we don't actually feel our disc. And the only thing we're aware of is when the disc has deteriorated to the point where the disc will actually collapse because it dries up, it loses its hydration or its circulation. And when that happens, when it collapses, it will actually bulge out. And the analogy I like to use for that is a plant that isn't getting water. We know that a plant needs oxygen, sunlight, soil, and water. If we take away the water from a plant, well, what's going to happen to that plant?
It just dies practically, just swivels up.
It dries. It dries up. It does, and it dies in stages.
Right, it doesn't die immediately.
No, it takes time. The first thing that'll happen, maybe the leaves will droop, and then they'll start to turn brown, then they'll actually fall off. So there's stages that it goes through, and the same is true with our discs. When they are not able to maintain their hydration, they will actually dry up, or the technical word for that is called desiccation. And then when they dry up, they actually collapse. Okay, it's like the air in the tires of your car. The tires are designed, all 4 tires are designed to hold the weight of your car. But if we lose the air in one of our tires, that tire now cannot function properly. We can't steer properly. We can't take corners properly.
Right.
We can't have our normal ability to drive that car. And the same is true with our discs. When they dry up and they begin to break down, and that causes the disc to collapse and then bulge out. And they get worse because the treatment that is typically suggested, which is part of what we call standard of care, involves pain management, which is treatment for the pain of the disc rather than the disc itself. And that's why it gets worse, is because the actual disc itself is not being treated.
Yeah, so what's the difference then between the procedure of, what you said and pain management?
Yeah, well,
I mean, there's there's obviously 2 different types of treatment. One would be ice, I guess.
Pain management can be using Advil, Tylenol. Pain management can also be going to your doctor and getting muscle relaxers, pain relievers, and anti-inflammatories.
Which are really not all that great for your system.
No, they affect your system. They pollute your liver and your kidneys, and they have their own side effects.
Exactly.
But then people, when those things fail, they usually are recommended to go to the next level, which is called pain management. And if we think about what pain management is, it's really 2 words, pain and management. So they're managing the pain rather than actually correcting the problem of the disc itself.
Exactly.
So
yes.
our procedure is we're able to actually identify the disc or discs that are involved, that have broken down and degenerated, and to target those. And with our unique procedure, we're able to get the hydration back into the disc and allow the disc to get what it needs. If the disc gets what it needs, it's going to have that opportunity to heal.
Yes.
If it doesn't get that, and we resort to pain management, that never actually fixes the problem. Yes, there can be a bump up front where they might get something as serious as an injection and they may feel better for a while. These injections have their own side effects, which are devastating, and they actually don't address the actual problem itself. What people are being told is their problem is the pain. You go to the doctor and the doctor says, well, what's your problem? I have pain.
Yes, but that's not really the problem.
That's not the problem.
The problem is they're shriveling up, or they're dehydrating,
Their
or
discs,
they're collapsing the disc.
and that's a very important order of how things work, is the disc loses its ability to maintain its own function. It can't hold on to its own hydration and circulation. And then the second thing is then the disc will collapse. And then the third thing is it will bulge out onto those delicate spinal structures, and that causes the pain.
Oh.
So by treating just the pain, we're not actually fixing the problem. So what's unique about our procedure is we're able to actually have a unique method of getting the circulation back to the disc so that it has that opportunity to heal. When we fix the disc, then we fix the pain.
Right. So it's kind of like you're allowing the body to heal itself.
The disc is living tissue.
It's living tissue, yeah, just like a plant.
Like any part of the body.
Yeah.
And God designed the disc with its own unique mechanism of self-repair, which is completely different than any other part of the body. So what our procedure does, it taps into that mechanism of self-repair so the disc can heal itself.
Wow, that is incredible. So basically, how would someone know if they were needing to have special treatment versus just simple pain management? I mean, it seems to me that why would anyone want pain management?
Well, because they have pain and that's all they know, and that's what they're told, and that's what the doctors recommend, and that's what's standard out there. That's what's called the standard of care type of treatment. Pretty much every disc patient I've ever had is someone who at one point didn't realize that their disc was their problem. So we need to evaluate that patient, and what we do is we first have a consultation. We will do an appropriate evaluation, which includes orthopedic and neurological testing. And then we also review the MRI to see if it really is the type of condition that is exactly what we treat.